Hello, ma'am.
हाँ जी sir.
Ma'am, right now we are in the live session. Please start.
All right sir. Ma'am is with us, right? Okay. A very good evening, all the attendees present in today's webinar. The topic for today's webinar is food and well-being during COVID-19. I request Dr. Ranjana Bhatia ma'am, Head of the Department IEPS, to welcome our guest and attendees present today. Over to you, ma'am.
Good evening to all. It is a matter of great pride for us that one of our alumni, Latika Ahuja, Dr. Latika Ahuja, is with us, and I wish Latika you could see me and see all attendees, especially your teachers who taught you. They are overjoyed, that our student has scaled such heights, and she has achieved so much, and she's doing so well that today we have invited her to talk to all students, faculty, to myself, and to Smriti. Congratulations to Smriti also for tracing you and for bringing you here. And she has told me that you are doing very, very well. And today's topic, which is already announced, is food and well-being during COVID-19. So, on my behalf, on behalf of Amity, entire Amity University, on behalf of IPES, on behalf of your dear faculty members, students, scholars, so many people are listening to you. I extend a very, very warm and affectionate welcome to you, because we are really, really proud that you are going to speak to us. So,
Thank you so much, ma'am.
you may now please start, and Smriti and Tamanna are both with you. I am also listening to you.
Thank you, ma'am. Thank you, ma'am. I take immense pride in introducing our guest speaker for today, Dr. Latika Ahuja, a research associate at the University of Exeter, UK. Latika is an alumnus of Amity Institute of Psychology and Allied Sciences, Amity University, Noida, and had graduated in year 2014 with a Bachelor's of Arts, Honours Applied Psychology. Besides excelling in academics and receiving a bronze medal for her performance, she was also the student coordinator and cultural head at IEPS. She was one enthusiastic student who motivated other students for planning, preparing, organizing student related activities and events from the clubs in institution level and also at the university level. To name a few, the organizing events that she had done is Amity Youth Fest, International Women's Day, International World Mental Health Day. As a student, she always had been keen on bridging a gap between her academic understanding of mental health and clinical knowledge. For this, she did various clinical placements and internships at prestigious hospitals like King's George Medical College, Lucknow, Apollo Hospital, Max Hospital in New Delhi. In 2014, Latika moved to Mumbai to pursue her master's in clinical psychology from SNDT College, University, Women's University in Mumbai. During this time, she worked as a mental health professional across various government hospitals, including JJ Hospital, Sion Hospital, and Thane Mental Institute. After graduating in 2016, she pursued her PhD in clinical psychology from the UK. Her PhD looked at culture specific and cross cultural factors of disordered eating behaviors in India and the UK, with an aim to highlight the importance of designing culture specific prevention programs and intervention strategies to address disordered eating behavior. During her PhD, she was involved with teaching various undergraduate and postgraduate modules and co supervised undergraduate dissertations. She also worked on different research projects in the area of perinatal mental health and personality disorders. Latika has presented research papers at various international conferences, including the ones that is British Association of Behavioral and Cognitive Psychotherapy London, International Eating Disorders Conference, and World Congress of Cognitive Behavior Therapy, to name a few. Her academic research papers are in process of being published and will be made available soon. Currently, she is working as a postdoctoral research associate within the Evidence Synthesis Center at the University of Exeter Medical School. The project she is involved in feeds into the area of implementation and policy research. Alongside, she is preparing self help material that aims to psychoeducate young adults on disordered eating behavior and provides the skill set to cope with it, which would be available online in 2020 August. Latika was a student at IEPS, and we fondly remember her as a brilliant student who was so curious to learn and utilize all the opportunities that came her way. She was a strong student leader who always went out of her way to help her colleagues. She always came up as a balanced person who was constantly evolving for academic and personal growth. Today, Latika will be talking about the relationship between food and well-being. What are the signs of the disordered eating eating, and how we can manage the disturbed eating during this stressful time, which is a critical topic of discussion for all of us right now. We will have 10 minutes at the end of the talk where you can ask her the questions and she will be addressing to your questions. And thank you so much, Latika, and thank you for joining us. And over to you now, without taking much time.
Thank you so much, Smriti ma'am, for such a warm welcome. And honestly, it's a pleasure to be back and be a part of Amity community. And even if it's virtually, I wish we could have, done this face to face. So thank you for the opportunity, and even Tamanna ma'am. Also, to all the attendees, welcome and thank you so much for coming and joining me for this webinar. And I hope you grabbed a comfortable spot and a cup of tea for yourself so that we can begin. So let me quickly pull up the presentation. So before we start, let's take a quick overlook of what we're talking about today. And let's reflect at three basic questions that this webinar aims to answer. First, why do we need to talk about food, and specifically right now in the COVID context? What changes in eating behaviors people might be going through, and are these the red flags that are of concern? And can we really do anything about it right now when it's at such an initial stage? Eating. It's not just a vegetative function that supports survival for us. I think for us Indians and even across different cultures, eating behaviors mark a value of celebration, tradition, and well being. Think of any festival that comes to your mind. The first snapshot that comes across is probably a table of food, which is full of food, and you're sitting with your family and your friends and you're eating. Now, many studies show that eating behaviors are related to all aspects of your well being, your thoughts and emotions, your motivation, your ability to cope, and whether your coping mechanisms are in place or not. Now, I would like to draw your attention on this relationship, which is probably bidirectional because it's not just these processes that impact eating behaviors, but I think eating behaviors impact these processes as well, which is why I'd like to think of it as a cause and effect phenomenon, where eating behaviors are a kind of indicator for you to understand how you're feeling. So it's important that we draw attention to eating behaviors, which is critical right now. Now, come to think of the COVID context right now. Our definition of normality has changed. And we've all been talking about the mental health of people. We're talking about how it's affecting our resilience, how is it affecting the way we are coping. And for good reasons. I mean, the norm of normality has changed completely. We are social beings, and now we are asked to maintain social distancing. We are questioning food security. the kind of roles that we are defined to, the boundaries are getting blurred. Also, we're thinking of what's going to happen next. And all these complexities of the current situation, they are causing a lot of distress amongst us. Now, this distress can subject eating behaviors to change. And there's a lot of literature out there that talks about how distress causes changes in eating patterns and behaviors. But the question is that change in eating, does it amount to disordered eating behaviors? So we're going to consider three basic principles of abnormal psychology that we learn, and those are deviance or disruption, dysfunction or impairment, and distress. So keeping these three principles in mind, let's think of eating behaviors that have changed. Are these atypical eating behaviors that differ functionally from the norm of eating within your cultural context? And is it associated with distress? And is it creating a negative impact? If yes, then probably that's a sign of a disordered eating behaviors. Now, disordered eating behaviors, think of it is as a continuum where people may not eat as much and people might eat too much to cope with distress. Now, there are a lot of studies that show that in India, disordered eating behaviors are really common, and it might be more common than you think it is, especially between the age range of 12 to 25 years. Now, people who are beyond this age range usually experience disordered eating behaviors due to distress, but also because of other issues that they're undergoing, maybe biological issues or emotional issues. Now, both males and females are subjected to disordered eating behaviors. Across studies, it's been noted that the point prevalence that at any given point, at least 20% people may experience this thing. Now, surprisingly, there's a gap between the research, what research is saying, and the gap between what clinicians see in their settings. Why? Because not as many people come up and they complain of disordered eating behaviors specifically. Maybe because people are not aware of it, and thus it is an underdiagnosed issue, or maybe because this issue is quite comorbid, by which I mean that it is a complex issue and it coexists with a lot of different conditions as well. Now, the factors that have been associated with disordered eating are self-esteem issues, your role of media in your life, low mood, anxiety, your body dissatisfaction, body image issues, dieting. Now, these factors, if you look at closely, this is exactly what we've been doing. I mean, come to think of it, we are all sitting back at home and we're eating and we're all the time into Netflix and other forms of media, which gives us an ideal of how a body should look like, which is slender in today's context. And we're undergoing distress because of the COVID situation. We don't know what's going to happen next. So that's the unpredictability. And while all this is going on, we look ourselves in the mirror and we find that we're gaining weight. Now, that's quite a tricky situation and makes the situation, the complexities of COVID, a breeding ground for disordered eating behaviors. Although I have to say that there's not a lot of data that supports this presumption right now, but coming from the literature that already has been established, it is quite likely that people start developing disordered eating behaviors. Now that we understand that disordered eating behaviors are for real in India and the current situation is probably the breeding ground of something of this sort, let's see that what are the different types of disordered eating behaviors. Now, there are a range of behaviors that could be categorized as one, but I'm going to be concentrating on three basic types. First is restrictive eating. So, on the continuum where individuals are suffering from disordered eating behaviors, one side is restrictive eating, where people are not eating as much due to distress. Now, one specific aspect of this kind of a disordered eating behaviors is that they are afraid of gaining weight. The second is binge eating, which is on an absolute opposite end of the continuum, where people indulge into eating a lot of food, and that is within a discrete amount of time. You mix the two, you get a third type, which is bulimic behaviors. And basically, what happens is that people binge eat and then they stop eating because they're afraid of weight gain. Now, across these three types, there are some common features. For example, individuals who are practicing disordered eating behaviors tend to evaluate themselves on how their body looks and what is their weight and shape, and also their ability to control. And having said that, while there are common grounds across the three types, there are also distinct features. So, for example, restrictive eating features the fear of weight gain, which might not be so within an Indian context, because there's a lot of studies showing that people who come up with restrictive eating might not experience that fear of weight gain. But that's a common feature. In bulimic behaviors, people who are practicing these behaviors are specifically very concerned about how their body looks like. And they tend to evaluate themselves on that. And this drive is quite strong in them. Binge eating behaviors are associated with a lot of guilt and shame and embarrassment because they just can't stop eating. They have to eat to control themselves. So, having spoken about these three types, there are other types of disordered eating behaviors, for example, emotional eating, night eating, and eating difficulties during an emotional disorder. Now, I wouldn't be getting into a lot of details in this because these are some other type of disordered eating behaviors, and the common grounds is basically that there is an emotional trigger. Now that we've discussed how changes in eating behaviors differ from disordered eating behaviors, let's shed some light on how disordered eating behaviors differ from eating disorders. Disordered eating behaviors are more common and they are likely to increase the risk for a future onset of eating disorders. Also, eating disorders are functionally more impairing and they result in very severe consequences. So, while eating disorders and disordered eating behaviors are both distressful, there are distinct differences that categorize them in different classes altogether. So, what do we do? Can we manage these? Of course, you can manage these. There's a lot of tools out there, and if you happen to include that in your lifestyle, and especially right now when things are so sensitive, I'm sure that you'll be able to prevent these kind of behaviors to moving to a different stage altogether. So to discuss how can we manage these disordered eating behaviors, I'd like to do that in the context of four most common complaints or problems that I've come across. And I've spoken to this about a lot of people, and personally, I've been experiencing these too. So I think I'm going to conceptualize management in terms to those issues. First issue, in terms to control. Now, a lot of people have been talking about the fact that they do not have control over over this current situation, that they're feeling a low sense of control because they lack predictability. I mean, things were pretty much predictable and certain before COVID happened. And now that they're stuck at home, it's impossible to understand what's happening. So, to feel in control, one thing that you can go about doing is that you pick up a very simple activity of your choice that you like to do and perform it at one given time of the day. That would provide you with structure and that sense of control that can help you understand the current situation more effectively. And this activity could be anything of your liking. Secondly, get active. And by saying get active, I don't really mean that you have to wake up in the morning and just get out of your bed and go about your day. You have to religiously follow a structure in terms to picking up one rewarding activity from what you like doing and include it in your day. And this activity could vary across days. Now, what you have to do is that while you're doing this activity, you have to maintain a record of how you're feeling while doing this activity. And that record has to be maintained and reviewed for the next 7 days at least. What happens then is that you're trying to understand that how you are being in control and what is its effect on the well-being as well. It's going to be impossible for you to do the same activity for 7 days at stretch. And there would be days where you miss on it. So what happens is that you need to tackle with this kind of avoidance and the reasoning behind it. And it's a very structured approach where you have to sit down with a paper and a pencil and take a record of the days where you missed on doing these activities. So, supposing you pick up an activity of playing an instrument if you're into music. Now, pick up a time, mix and match the two techniques, pick up a time, play your guitar or whatever instrument you're playing, and record the mood, the days you happen to miss playing on the instrument. Maybe try and reason it out. See what were the factors that did not really allow you to pursue that activity further. Obviously, if you're playing this instrument while your mom is sleeping in the next room, that would be an issue. So you might want to go with a plan B. Maybe change the activity or maybe change the time of the day that you're playing this. Second situation is a lot of people are complaining that they are reminiscing about the past, about their failures, and they're getting into this zone of thinking negatively and they're over worrying about the situation. One thing is that once you get a lot of time at hand and you're sitting back home, that is bound to happen unless you make yourself active enough. But if you happen to be in a situation like that, something called as thinking healthy could be pursued. Now, this is not at all philosophical, it's a very structured activity of how you have to go about it. So, what you need to do is that if you identify yourself into that situation where you're thinking too much or you're worrying about things, sit down and ask yourself, what is the effect of that thought on you? Is it making you happy or is it making you sad? And once you do identify the effect, distract yourself. Instantly distract yourself. Now, the best way to distract nowadays is that we have our phones at the disposal. So just pick it up, maybe pick up your favorite track, and you start listening to it. Once you feel distracted enough, challenge your negative thought and ask yourself, how realistic is that? And is there an alternate explanation to it? So, supposing you sit back and you start doubting yourself too much and based on your past failures, ask yourself whether you're happy or you're sad, distract yourself, and then try and reason out that what were the factors in the time before where you failed and you started to doubt yourself. And if you change those factors completely in any future similar situation, would you still fail? I think I find it really helpful that I've always been a person who've maintained a journal that I use as a reflective diary as well. And I like to document my thoughts. And one way of going about understanding how you're thinking and why are you thinking a certain way is identifying patterns. So while you take notes in your diary, one way is that you start picking up on factors. Is it a certain time of the day where you're feeling out of control when you're having these negative thoughts and emotions? Is it around a specific person? Is it after a specific conversation or a thought? And that makes you connect the dots. So the next time you are entering that zone of negative thoughts and emotions, you exactly know what are your trigger points, and then you can prevent those trigger points to get activated. Yes, we are reaching that stage that we are agitated, we are frustrated because of the lockdown. And those anger bursts are actually coming out on our relationships, on our families. And we do get into these arguments all the time. And it's not just the frustration of being at home, but the fact that you're not in control as well. So if you find yourself in a situation where you're furious, the first thing is hit the pause button and visualize. All you have to do is pick up a sign that is denoting of danger for you, maybe a danger sign with that skull and two bones across, or maybe like a red cross sign right on the face of the person you're furious with, and stop yourself right there and then. Tell yourself that the anger is damaging the situation because it actually is, and tell yourself that anger can be controlled. Now, how would you go about controlling your anger? You have to engage into specific behaviors at the point that deactivates and diffuses the situation altogether. start counting backwards. Or maybe you can pick up a category, maybe flowers, and start naming flowers, 10 flowers. So that instantly your focus from being angry shifts to something else. Stop reacting to the situation or walk away. And I know most of you would feel that this is very culturally sensitive. And once you do this, your parents are going to, they'll make a havoc out of it. But walking away does diffuse the situation. So I would truly suggest you to try it. I mean, it's easier for you to come to the person later on and try and explain the person that, okay, you walked off because dot, dot, dot. And rather than being there in the situation and being angry and, just making the entire thing worse. The last thing is not realizing how your day is passing by, and everybody's been on to this. People are saying we wake up in the morning and I don't know what I do the entire day. And by the time I realize I'm into my day, my half of the day is past and it's time for me to eat and sleep again. This is because before the COVID happened, we were actually in a very autopiloted mode. We used to wake up in the morning, go about our schedule, get back home, go about our schedule again, and then just sleep. And we didn't have a lot of time to process what's happening. Now, what happens in that is that you don't really realize what's in the present. One of the most effective activities I've personally found very useful is mindfulness. Now, it's not a traditional meditation technique and it's not associated with any spiritual beliefs or religious practices. It's simply a technique that can help you switch off the autopilot mode and it's going to get you in the present moment. It would prevent you from going in the past and it would not allow you to probably go in the future, which you do not know of. So it gets you in the present moment, which makes the situation more comforting. There are a range of exercises on mindfulness that you can go about. These are just the 3 that I like to practice. So I'm suggesting. The first is mindful eating. Now, what you have to do is, while you're eating and your bowl of food is in front of you, just be there with yourself while you're eating. Use every sensory perception to understand what you're eating. Your eyes, your taste, your touch, every sensory organ needs to be activated while you're eating. And this is just one exercise. You can pick up anything else. Maybe when you're brushing your teeth in the morning, that has to be mindfully done. That could be another exercise for you. The next is making a list of pleasure and mastery activities and include it in your day. Take a piece of paper, put down all the activities that make you feel good about yourself, that make you feel in control of yourself and of your day, and include it in your day. The last is visualization activity. All you need to do is hit your YouTube app and put in a safe place visualization or a calm place visualization, and you will get a list of videos that would guide you of how to go about it. But one thing that you have to keep in mind while doing this specific activity is your thoughts would come in your mind. Your mind would wander off to places that are probably more attractive. But the entire purpose of this activity is that you have to gently ask yourself and very kindly tell yourself that your thought needs to be on the visualization activity. You have to be in the present. So allow yourself to wander off, but then gently get yourself back into the activity as well. Now, for these points, please take a snapshot of the screen. And I like to do it in a way where I take these points on a sticky note and put it where I can see it every day. Tell yourself that it is okay to struggle. These are changing times, and it is a very complex situation right now, and everybody is going through these issues. So it is fine if you're struggling too. Tell yourself that you have to be kind enough to yourself and to others because all of you are in the same boat. Take care of yourself. Self-care is important. Take it as an opportunity to reflect back hit the pause button, process what you've already done, process what you want to do, and do everything which you haven't been able to do because of your busy schedules in the past. So take it as an opportunity to grow and learn. Most importantly, be proactive when you're in distress. Everybody has been going through some sort of a distress or not, and there are things that you can do to control it. Make a cocktail, not the drink. I'm talking about a cocktail of all the management techniques that I've just discussed with you, and see what works the best for you. You have to customize it in a way that you would want to pursue these management skills. And if you happen to come across anything else that's helping you out and I did not cover it in this webinar, tell it to me. Email me later on. I'm going to share my details with you and let me know. I mean, I'd like to share it with other people. You talk to other people and tell them about this webinar, the management skills that we've spoken about, and your personal strategies that have worked well for you in the past. So before I wrap up, just a quick recap. So, disordered eating behaviors is real, and the current environment of COVID is quite conducive to it. So, just watch out for the red flags. Do not label any changes in your eating behaviors as disordered eating behaviors or eating disorders unless you go to a mental health professional, a psychologist, a counselor, and they try and pin it down to that. Take control of this period by getting active. Just don't get out of the bed. Do something which is productive and makes you feel better about it. Thinking healthy will get you through this period. It will. Just try. And let's not react. Let's rather respond to the situations at hand. Let's process every bit of information and emotion we are going through right now. Be mindful and not mindful. Your mind already has a lot of stuff that's going on, so it is full. But be mindful and aware of that and cut yourself some slack about it. Thank you. And this is my contact information, just in case you want to get in touch with me later on and ask me questions. I'm there to help you out in any way possible. So, Smriti ma'am, over to you.
Thank you, Latika, for the talk. And now the forum is open for question and answer round. And you can see how many flooded questions you have, Latika. And we can pick it up, we can pick it up one by one.
I actually cannot.
Okay, so you want me to read it for you?
Yes, ma'am. If there are any particular questions that you would want to prioritize today.
Okay, all right. The first question is relating to your PhD. So, could you please brief about your PhD concept and the outcome of your PhD?
Okay. So my PhD was about a cross-cultural investigation on factors associated with disordered eating behaviors, and I was really interested in understanding the perspective if there are any Indian factors that could lead to disordered eating. And the entire idea that was pursued was of the fact that we know a lot of things about the universal factors that are at play, but because of the complexity of Indian culture, I wanted to understand if there could be any other factors that could lead to disordered eating. So in doing so, we tried to combine the two worlds, an Indian perspective and the Western perspective as we know it. And we conducted a few studies. There were a range of studies that were conducted, did a systematic review, did a qualitative investigation, a few quantitative investigations as well. And what I found out was that obviously there are common factors of disordered eating behaviors across cultures, but the way they interact with the cultural context makes it different of how people might experience and for what reason people might experience disordered eating behaviors. So, a couple of factors that came across as common were achievement and the sense of control. And a specific factor that came across as very predominant of related to disordered eating in India was suppression of self. And this suppression of self was contextualized between how suppression is practiced on a broader cultural level in front of parents and within marriages. So that was basically the sum.
All right, thank you for the answer. We have another question, that is, to what extent psychodynamic factors lead to eating disorders?
I think there are so many papers written on this thing, and in terms to how your relationships are, how your thoughts that have been in your subconscious, that relates to disordered eating behaviors. There are a lot of papers, and it's a very well established fact that any experiences from your childhood, any experiences in terms to your relationships with your parents in the childhood could lead to a future onset of disordered eating. And that really the kind of disordered eating that you might experience would be a very biological thing, because every specific subtype has neuropsychological underpinnings, and it is basically a genetic predisposition of a person to start following a path of restrictive eating or binge eating, for that fact.
Right, thank you so much. I have another question for you from the audience. It is, if I have an underlying physical condition, what can I do to stop myself from eating unhealthy food?
I think that's a tricky question, because if you already have a physical underlying ailment, that would have been there in the past as well. So, whatever you were doing and was working out with you in the past before the COVID situation happened, that would you would have to continue doing that. But if your question is specifically about how can I include physical activities in my, right now when I'm not able to get out or go to the gym or go for the yoga classes that I used to go, there are a lot of videos out there on YouTube that instructs you to get into a physical regime, and you can follow those routines. Also, recently I got to know, and this is really interesting, and I'm going to try myself as well. A lot of Zoom sessions are happening where people from different parts of the world, they come onto Zoom and they have exercise sessions, they have yoga sessions, they have meditation sessions, and people do it together, which gives you an opportunity to not just nurture the current relationship, but to build new relationships across the world. And I think the kind of bonds you establish now would be quite strong, given that everybody across the world is undergoing the same amount of distress and is, looking at the same level of complexity of the current situation. So I think that's something that you should try out.
All right, thank you for the answer. We have another question which says, thank you, Dr. Latika, ma'am. You have told us a diary writing and given a new idea relating to diary writing. Thank you. We are thanking Amity University for organizing this webinar. Now the question is, I want to ask that, can you differentiate between disorder of eating with eating disorders, disorder of eating with eating disorders, with any relevant example?
So there's nothing as disorder of eating. I'd rather call it as disordered eating behaviors and eating disorders. So eating disorders, like I said, eating disorders and disordered eating behaviors are quite common in terms to the clinical signs that raise queries. But eating disorders are definitely more severe and they are more persistent. There is a lot of comorbidity in those, and the consequences are really severe. So, a person, supposing with anorexia nervosa, which is an eating disorder, is characterized by a massive weight loss, and to an extent that it has physical consequences. So, the person ends up being in an inpatient facility for a bit, where a lot of other therapies alongside psychotherapy happen. So basically, the person is refed, and they are on proper medication that helps them restore the weight and deal with all the physical complications. Now compare anorexia nervosa to a restrictive eating issue, where restrictive eating is just the beginning of how a person might get into the entire idea of restriction. And are there any factors around that time that tend to maintain such behaviors that it converts into an eating disorder? So disordered eating behaviors are quite distressing, but are definitely more common, and they are not as, you can't simply diagnose them because their severity and their visibility isn't that much. So once a person has gone through a disordered eating behavior phase and is suffering a lot, is when anorexia sets in, and that becomes more visible to the parents, to other people around you. And that's how it translates. One another distinction between a disordered eating behaviors such as restrictive eating and anorexia nervosa is that person with anorexia nervosa doesn't really have an insight. Like, if you tell them that you've reduced your weight to an extent where you can't really go further unless you happen to damage yourself to an extent that you end up in a in-house facility, they wouldn't have that insight. Whereas a person who has restrictive eating behaviors does have an insight, and they would agree to an extent that they are restricting themselves from eating food. So that's how it differentiates.
Okay. So there's a question from a student who has asked you, how does anger and emotion impact one's eating behavior? There are times when we are very angry and we refuse more, that no, I don't want to eat. And then later, after a full cycle of 24 hours or so, when your anger is reduced or in the less intensity, then you're back. But how does it relate?
I think it's a very interesting question, because a lot of people might just restore to a normal appetite the next day. They might just go around, with their respective situations, deal with it, and they would get into a regular eating behavior after that. But depending on the contextual factors and the pre-environment that was set, people might continue with the restriction, or they might binge eat, and then they might restrict themselves, or they practice some form of a compensatory behavior. So it really is about how your life has been until now. So supposing eating is there's a lot of literature out there that associates eating behaviors as a coping mechanism of a lot of anger issues and emotional issues that have been there. So once the person starts using regulating eating for the diffusion of emotions, that's how you prime yourself into getting into that zone. So in case there have been relationship issues in the past, and there have been often anger bursts, and there's a persistent low mood, anxiety, sadness, and once you start practicing regulating those emotions through eating, it might become a pattern. And if you're genetically predisposed to develop a eating disorder, you might actually end up with some form of difficulties later on. I don't really see the factors that usually cause eating disorders. It's not something as simple as that one factor is leading to an eating disorder. Neither the emotions nor the media, the socio-cultural factors at least, nor the thoughts, and neither the genetic predisposition. These factors don't play individually. These are basically working together to end up a person with an eating disorder.
All right. Thank you so much. So, okay, there's another question. If one has a sedentary and stressful routine, like how it is with doctoral students, I'm sure this is from a PhD scholar. What would be your suggestion for such students to instill healthy eating?
I mean, out of personal experience, I know this is definitely somebody who's pursuing research career, and I can understand the highs and the lows of the journey. And I mean, when I was in that phase, I experienced the exact same thing where, you know, I would have meals skipped and then I would end up eating too much. And there was like, it was an emotional roller coaster. So I ended up sitting down in front of my computer with a tub of ice cream. So I know what where you're coming from actually. And one thing that helped me out was I used to schedule my meals a lot. So I used to have smaller portions of meals more regularly. And I had to stick to that because unless I don't stick to it, I would miss on it. So no matter what you're involved in, you have to keep it aside. And even if it's for 10 minutes that you're taking that break, take it, take those 10 minutes aside for your eating. And try and probably, depending, this is something that's very personal. And depending on, the kind of food that you like and how that food affects your productivity and your efficiency in terms to work, choose those kind of food products. So for me, what worked out was that in my lunches, I used to have salads and soups and, a lot of dairy so that I could, just focus on my work after that and not feel sleepy and, drowse around. But of course, I mean, dairy isn't an option if you're lactose intolerant or something of that sort. So I think that's something which is you would know about your ingestion better than I would.
All right. So we have a faculty member who have messaged that, hello Latika, very, very, very proud of you and happy to see you in this platform. God bless you. And the question goes, under stressful situations, we tend to eat a lot. I think you have addressed to the question in your PPT, but she would have joined later. So under the stressful situation, we tend to eat a lot. How to get the avoidant and controlled behavior to take care of such bad eating pattern?
So it's under a stressful situation, right? I think one way of going about. So I mean, I just don't. I'm a very behavioral person, so I need to do something which actually gives me an instant relief of the stress. So what I like to do is that mindfulness is one go-to that I like to do, and there are different activities that I resort to as well, and also something as maintaining a reflective diary and seeing how my day has gone by and what kind of triggers were involved. I like to keep a track of that. Having said that, I like to keep some time off to do something that I like and I find rewarding enough, and I try and associate that with my mood. So that is something that gives me pleasure that ways. Also, one thing, the point that I mentioned before and towards the beginning of the management strategies was picking up one simple exercise and doing it in at one given point in the day and doing it regularly. So that's something that works out for me pretty well. So for example, I've been out of home for like good 10 years now, and I like to speak to my parents every day. And I've picked up a time that suits them, suits me as well. And I speak to them every day, even if it's for 5 minutes. So that's something which gives me pleasure and control, and I have a go to at that point. So that's something that helps me out. And I think a lot of people have, people who I've spoken to and, try to help them out in terms of managing their stress levels and disordered eating behaviors as well. These things have pretty much worked out for everyone. So it's a standard set of strategies. But at the same time, I am absolutely up for customizing such strategies for individual use.
Thank you, Latika. There's another quick question. Many people tend to eat a lot, even when they are happy. Why is it so? And how can they control this?
Yeah, I mean, when I was talking about emotional eating as a pattern of changes in eating and disordered eating behaviors, emotional eating is not just when you experience negative emotions, and it's also when when it's you're in a festival, or you're really happy and you start eating too much, and or other way around, you might not eat as well. That's another mechanism that people go about. They regulate their eating in a way where they're restricting. So I think I know. I mean, festivals is a situation where you can't really avoid if your family is around and you're back home. But one thing is that I'd like to maintain like a mental record of what I'm having, and in what quantity am I having, and how. And I try to evaluate my physical comfort as well. I mean, because even if you're eating too much out of happiness, there your body is very intuitive, and if you're mindful enough and if you're aware enough of how your body is feeling, that is a red flag where you need to tell yourself that, okay, I need to possibly put this food aside for a while, or maybe eat it the next day, and not at that point. So that's something which could be helpful in that case. But I know it's very tricky in terms to not eating when you're happy, or if it's a situation that calls for eating too much.
Thank you. We have one more question that is come on the personal chat. Are there specialized clinics for individuals with eating disorders in India?
I don't think so. There are any specialized clinic, for the simple reason being that mental health in India follows this is very eclectic in approach, and there are very centralized services. And I mean, it's just sad in terms to the kind of facilities that are existing already. So specialization is something that needs more resources, more personnel, and more effort into it. So I don't think there are any specialized services as of now, but there are people, mental health practitioners, who have an interest in possibly looking at specific kind of mental health issues. Probably they're specializing in disordered eating behaviors. There are therapists that are possibly practicing a specific kind of therapy, like they feel more comfortable with a specific school of thought, that what kind of therapies are more suited, for example CBT, or behavioral activation. So I know people around that are specializing in certain aspects of mental health, but there are not facilities as such right now.
Okay. You can check your books also, and I'm feeding the question.
I think there's a question here. I'm doing a society from IBAS. What is your view on having food as a coping mechanism, both in a healthy and in unhealthy ways? That's a very good question. Usually, coping mechanisms. Food is vital. Why? Because of the kind of cultural importance and the physiological importance that is placed on food. And when it comes to stress, that's something that is a go-to for a lot of us, a lot of people. So people are definitely using food as a coping mechanism. But one thing that you need to understand is that if you're coping through food in a healthy way or a not so healthy way, it is ultimately you're using food as a coping mechanism and not for the original purpose of food, for survival, for pleasure, for these things. So coping that goes to any extremes is harmful. So whether you're indulging in too much of binge eating and high caloric intake foods, or if you're being too cautious about your eating and engaging into all forms of diets and all, that increases the risk for developing disordered eating behaviors in case you're already within a high risk sample. So supposing you have a genetic predisposition for developing an issue with eating disorders, so any form of extreme that you might go for can act as a maintaining factor and can act as a precursor to your future disordered eating behaviors. So rather than associating food with coping, I feel it is uh, it is important that we cope with our situations and our context in a healthier way.
Thank you. Another lot many questions are there, and they're very interesting questions. Okay, one, I'll read it for you. We spend so much of time on media, and I have particularly found myself distressed looking at other people's body shape goals. What do I do?
I think the best way out of this situation is obviously, see, you can't really control the content of the media. So, what you could do in terms to controlling yourself and your exposure to such content is that look at media in a different perspective. There's something called a body positive movement, which is basically rooted in the idea that every human needs to feel positive about themselves, even their weight and shape. And that's a very big thing that's budding up in the Western cultures, and that's taken over as the fourth wave of feminism, where you got to be comfortable in your skin of how you look. Ideal shape that they are propagating needs to be undermined. So I would suggest you to be a little proactive in terms to looking up for content and web pages that are related to this body positive movement. Simply, if you put this phrase down on Google, you're gonna come up with a lot of results that orient you to different projects and different media sources that can talk to you about this. Also, I think the other thing is that you need to associate yourself, your understanding of your personal self, in terms to your achievements rather than, maintaining a specific kind of a body weight or a shape, which is something that the media needs to address. But obviously, you can't expect something to change overnight. I mean, it took so long for this idea of ideal body shape, which is a cylinder body shape from the Western cultures, to come to India and affect the Indian media. So that's not going to happen overnight. But you got to expose yourself to something which helps you be comfortable within your own skin for now.
All right, so we have one more question. Uh, Due to paucity of time, I think we'll take it as the last question of the day. Uh, how do you restrict or control the cycle of addictive eating of fatty foods since consuming fat, saturated, and unsaturated releases ample dopamine and serotonin, especially when one is feeling negative emotions? So, how do you tackle that? Can you guide us?
That's something which is really important to address, and good this question came up. So a lot of people associate binge eating, I mean, that's how actually the thought process is, that once you get into this vicious cycle of coping through situations, using this thought process, that it's going to release a lot of dopamine, and I'm going to feel good about myself and about the situation if I have a lot of food, and you actually tend to you tend to enjoy it, and you tend to cope with the current situation. For you to actually allow your brain to release dopamine in a more healthy way, there are so many other activities that you can indulge into. So I'm not trying to rationalize this thing, because I understand how severity of that thought process disrupts your rationalizing ability. And if you're already somebody who's going to a therapist about it, and you're undergoing issues, and that's something that's supposed to be a part of your therapy sessions, where it needs to be addressed, that exercises and involving yourself into something which is pleasurable to you can be an agent to release dopamine. So it's not about rationalizing, I'm saying it again, but it needs to be addressed within proper sessions. And the thought processes behind this mechanism of why you're associating your eating behaviors to dopamine release and your feeling good factor needs to be addressed, and that's how a behavioral change takes place. So basically, it's both about your thought processes and behavioral activation that is at play at the same time.
Thank you, Latika. We are on time, and there's a student who has asked this question with not many pleases, and I'll take up this last question.
No, go
You
for
know,
it.
okay. I want to pursue research in the area of eating disorders. And believe me, there are a lot of undergraduates who actually pick it up as a term paper to learn about eating disorders. So this question goes, I want to pursue research in the area of eating disorders. Any suggestions how to go about it?
Well, it's a very interesting area, and it's an area that has a lot of scope, and that is a personal endorsement, having spent last 4 years and still trying to pursue that area of research. I think there's a lot that needs to be done, and lot of the research that's now available in the past has happened in the past couple of decades. And sadly, the quality of research out there in India is not that great, simply because people have only recently taken to understanding this issue on a more clinical level, and they have become more research oriented to addressing this and understanding it within how things are. So one thing, I mean, I would say that's a question that you need to define for yourself. That what are you really interested in? Is it something that relates to your you want to understand disordered eating behaviors or eating disorders within the Western perspective, and try and replicate research that's already been done with a better sample size, and something that makes your findings more generalized within the Indian context, or whether you're interested in looking at how common these disordered eating behaviors are, and then you can pursue something like a large scale prevalence research, or you simply want to understand, if there are specific cultural factors that are involved, and go for a methodology that I used and try to understand it. So I would encourage all the attendees to actually read things that are already available, Indian literature that's out there addressing eating disorders, and try and determine the kind of research gaps that are available. Another research gap that's available in this area is that we do not have a lot of tools that have been standardized within an Indian context. So whether it's about estimating prevalence, or whether it's about understanding the factors that are associated with it. So we don't have a lot of scales that can actually establish the current understanding of eating disorders within an Indian context, because they are not standardized on the population. So that's something that's another area of research that could be taken up. So it really depends on how you want to pursue this area. But for sure, one thing that's for sure is that there's a lot of scope and a lot of avenues for further investigation in the area.
Right. Not many thank you messages are just popping in. Thank you, ma'am, for the wonderful session. It was an amazing session to attend. Latika, with all due permission of HOD, ma'am, I'll take one last question, which is related to COVID crisis. It
Yeah,
is,
sure.
what if you already are suffering from a stressful situation, like recovering from a surgery, and then the sudden onset of COVID crisis, cause of which you are more stressful? How to handle this anxiety and disordered eating pattern in this situation? The last question of the day, and then we'll wind up.
So, I mean, from the question, if you whoever has asked this question, because of the surgery issues, I understand that mobility is probably one of the issues. So, I mean, that's getting into some kind of a physical activity, wouldn't like. I mean, the management techniques that we discussed in terms to getting active, that's not something that's feasible for you, and so you have to probably substitute that with strategies that are sitting back in your bed and trying to do something that helps you out. I think one way of getting about is, basically, with surgery comes the post surgery impact, and that has a lot to do with the negative thoughts that are at play. and also, you trying to process the situation while you are dealing with the complexities of the COVID situation. So mindfulness is something, the strategies that I explained, that is something that you could go for. Also, the kind of strategies in terms to sitting back, doing something, and then processing your thoughts and emotions is something that you could go for. Also, I would suggest that there are a couple of strategies within mindfulness, which is called body scanning stuff. So if you punch in that on Google, that's going to probably give you instructions of how to go about it, and that's something that could be useful.
All right. I would like to continue now. Quite a lot of questions from students and faculty members. It's really
No, it's
amazing
been
to
such a fantastic response. I mean, I'm really happy that people liked it and they found it useful.
Yes, definitely. And your talk was really interesting with relevant concepts that you clear to, with all our audience and attendees. And I believe it equips us to deal with distress and changes in eating disorders more effectively. We will definitely be leaving this session with useful information about how to recognize the early signs of disorder eating and address them not only in lockdown but in general too. Um, Officially, the event is closing because of time laxity. Tamanna ma'am, I'll just do the formal thank you and acknowledgement.
Yes, ma'am.
On behalf of IEPS, I would like to extend heartfelt thanks to Founder Sir, Chancellor Sir, Vice Chancellor Madam, Head of the Department Madam of IEPS, guest speaker Dr. Latika Ahuja, our faculty members, our dear students, our research scholars, our admin department, IT support team, and all the attendees for being with us throughout the session. Thank you, one and all. Thank you for being so patient, and I hope you all have learned a lot from Dr. Latika. She's also the alumni mentor for our department. You have any other questions which are left unaddressed due to laxity of time, you can please write to her or you can direct it to Tamanna ma'am or me. We'll definitely get you the answers and connect you to Dr. Latika. Thank you so much. Thank you, Tamanna ma'am. And
Thank you so much.
thank you, Ranjana ma'am, for giving us this opportunity on this platform to meet our alumni. It was lovely to have her on the board. And again, thank you, ma'am. Thank you so very much.
Thank you, Smriti ma'am. Thank you, Tamanna ma'am and Ranjana ma'am.
God bless you, Bitter.